Hi everybody, Dr. Lee Coleman again. Thanks for joining me. And this session I want to illustrate some of the things that I talked about in these recent sessions about psychiatry's medicalizing of treatment of patients, how wrong I think we are going by following their model. And I find that every week something is coming up in the print media or on the internet which illustrates how one-sided the story is that psychiatry is telling to the public and the way it's causing them to get more and more powerful and more segments of society jumping on the bandwagon. In this case, 60 Minutes, what I think is generally thought of as a pretty good investigative program, jumping on the bandwagon and being very supportive of psychiatry's use of shock treatment. The segment was on Mother's Day, May the 13th, 2018, Anderson Cooper reporting, and it was called, "Is Shock Therapy Making a Comeback?" And we saw a film of two people who were getting shock treatment, and we learned quite a few things from the doctors, two different doctors who had given the treatment. Let me just give you some examples of some of the things that they were saying about the treatment, that the treatment may work wonders. It's not something that you have to be afraid of. And that was Dr. Sarah Lisenby, who works not only at the National Institutes of Mental Health, but is the chairperson of the psychiatry department at Duke University. So once and again, we're not talking about a few people, we're talking about mainstream psychiatry. And then there was Dr. Charlie Welsh, who was also a patient, was receiving shock treatment. And we heard from him things like, in the past, ECT was the most vilified treatment in psychiatry because of the way it used to be administered, but that it's much more refined now. And then Anderson Cooper chimed in that there was no anesthesia and too much electricity given in the past. To which Dr. Welch came back, right in sync. Well, what's different, first of all, is that it's done under general anesthesia, and the patient is sound asleep and completely relaxed. So it all sounds pretty good. And we also learned from Dr. Lisenby when she appeared later on that it's been modernized to reduce the amount of memory loss. Well, none of those things are true. It's not only what they said, but what they didn't say. It's very important to understand that electric shock treatment is done in the most important respects exactly as it's always been done. Electricity in dosages that are way beyond anything that the brain could possibly deal with. It's put through the scalp, through the skull, into the brain, spreads out over the brain and down to the peripheral nerves in an amount which is dangerous to the brain. The fact that the patient, and not only just recently, but for the last 50 years, they have used a muscle relaxant. This is not a new thing. Succinylcholine is the type of drug. It's the kind of drug that natives in South America used to use in their poisonous darts. It paralyzes the muscles so that the animal would drop to the ground and not be able to resist. Shock treatment is preceded by this drug being given so that when the electricity is put through the skull into the brain, that impulses that are passing through the brain and into the peripheral nerves are not able to pass into the muscles. So you don't see the patient with a big seizure. But I ask you now, you lay people out there, without your medical degrees and without the need to defend psychiatry, do you think that how much the patient has a seizure that you can observe on the table does anything to reduce what the electricity is doing to the brain? Of course it doesn't. Yet that was not mentioned one time on this program. Not one question was raised by Anderson Cooper. Not one comment was made by Dr. Lisenby or Dr. Welch about the fact that blocking the muscular seizure that you can see does nothing to reduce what the electricity is going to do to the brain. Now, when you realize that they're not treating any medical disorder, depression, as I've been telling you in previous sessions, or any of the mental disorders that we are talking about, has no known medical cause, then how could the electricity be helping the brain? There's no question that electricity into the brain will change you for a while, just like a blackjack will. You can get drunk, and for a while it'll change your brain. Now, when a person is given a dose of electricity to the brain, and then it's given several times a week for several weeks, the person is going to get changes, not only loss of memory for events around the time that the shock is given, but nobody in the program ever mentioned, what about learning? What about new learning? What about the ability to retain? There's plenty of evidence that people who get shock treatment, several courses, and the more you get, the more danger, will have learning deficits. But the people who continue to use shock treatment, all they focus on is, does the person change in the immediate few weeks or month or two? They may change in ways that you can define as improvement, like they may start eating a little more. They may not tell you about how depressed they are, and they may feel less depressed because the injury to the brain puts them in a more primitive state in terms of their emotion, their attitude, what they think about their life. So the fact that electricity changes you for a while does not say that it's an effective treatment. And here's another thing. Nobody ever raised the issue of whether genuine consent is being given to these treatments. The law says that consent can never be genuine if you're not told the truth about both the potential risks and the potential benefits. Well, I submit that the statements of the doctors and the whole attitude of 60 Minutes was such that this was a promotional thing. Neither of the people who were given this treatment were given information that would allow them to make an informed consent about whether they would want it. So it's really an illustration of how deep we've gotten into the problem of the medicalizing of psychiatric treatments, that misinformation that is being given to patients. And finally, let's talk about the subject of stigma. Stigma was one of the points that was brought up as to why people should get the treatment more often. That due to the unfortunate stigma that was given to electroshock treatment, it was said, not as many people are getting it, and there's no reason to be afraid of it. I think there is a reason to be afraid of it. And I think there's a reason to be afraid of the milieu that patients get put in, where they're pressured and sweet-talked into getting a treatment, and they're not told the truth about what shock treatment can do. So if the doctors are going to keep doing it, and we know that they will, but even programs that have no overt reason why they should be so willing to jump on the bandwagon as 60 Minutes, then we have a lot of work ahead of us. A lot of work. I'm very pleased that you're here. Don't take anything I'm saying because I said it. Use your experience, study, talk to people, form your own opinions. Because if we're going to make any progress on these issues, it's got to come from a broad base of people who are unwilling to simply take psychiatry's word for it. Thanks again for coming. See you next time.